when I went to medical school and I went to residency and everything else, we were able to treat acute diseases or short-term diseases really well. You could go to the emergency room, you could go to your primary, you could go to a specialist, but we really didn't have a ton of exposure to chronic diseases and what you do with them. What our exposure was is that you put them on medicines and then nobody really knew what happened to them after that. I remember working in the emergency room as a resident, and I said to the emergency room doctor, so do you know what happens to the patients after you stabilize them? He said, no, and I've never been curious about that. And that had a
What?
resounding effect on me. Like, then what happens with their care? And this isn't to take away from these
Yeah.
very positive emergency medicine doctors who are very powerful and they do great things to save lives and stabilize people. But it was a way that showed me that chronic care needed assistance, that people needed more than just the
Yeah.
conventional approach. So I started looking outside. And that's when I ran into what is either lifestyle medicine or integrative medicine. I call it integrative medicine because
Hmm.
it's an integration of both conventional medicine and lifestyle modifications, including the nutrient dense diet, as well as stress management and fitness. And what I find is that unlike conventional medicine, there's reversal of disease. You can't
Hmm.
reverse disease with conventional medicine for most chronic diseases.
It's true.
But this has given us a very powerful tool in the
Yeah.
armament of medicine that we never had before. And we're on the precipice of really minimizing chronic diseases and letting people live a longer lifespan.
Right. Wow. Well, what is your thoughts on medications? I mean, do you still prescribe them?
Well, that's interesting. I believe that medications are a good thing when used wisely. But when it comes to medications, most of the package inserts for what the medicines got approved for are based on between 6 months and 2 years of data. So we get into danger when we have patients on medications and we leave them on medications for 30 years. So, for instance, let's take an example. Proton pump inhibitors like Prilosec that's over the counter, or Nexium that's over the counter. Have you heard of these?
Oh, absolutely.
Before I went to medical school, I was a pharmaceutical rep and I was on a launch drug for HIV. And this launch drug, I remember having a guy present to us, and he told us that proton pump inhibitors had the cleanest profile for a reflux disease and that there were no side effects. And compared to HIV, it was nothing. It was easy. It was the greatest drug. Now, fast forward about 20 years. Now we see that when we've had these people on proton pump inhibitors for 20 years, we now see B12 deficiencies. We now see fractures because of leaching of calcium out of the bone. We now see absorption problems. But
Right.
even worse, there's now a small side effect. It's a 25% increase in risk. Now, it was a small event rate, but a 25% increase in risk in a small side effect that only happens once. It's called death. So when people
Small.
are on small, death, it's one of those things that'll never
Yeah.
hurt you again,
Right.
but you won't be coming back either. So
Yeah.
proton pump inhibitors are not
Good
mild,
things.
right? They're not good things, especially for long term. They were meant for the patient to use for 2 to 4 weeks and for the doctor to use for 4 to 6 weeks and then reassess. We seem to have left them on that. And the same
Yeah.
thing happens with many other medications. So, I mean, it's not about medicines being good or bad. Medicines have their place and they can be very valuable, but you've got to be very judicious in how you use them. Doctors will sometimes go for the highest dose, and the FDA even told us don't start people on the highest dose. And if you don't have to use it, don't use it because it can cause all these problems, and yet you'll still see them on very high doses. So what you want to do is if they're on medications, start slow and go low. And somehow we've lost that. And when I was in medical school, that was the phrase that they always taught us, which is start at the lowest dose and don't move it up very quickly. Go slowly and see how the patient reacts. Because every body, not everybody, but every body is different.